Time now for Newstalk this half hour. Dr. Timothy Pfister from Aesthetic Oral Arts is live in studio to answer your dental questions. So fire up those phones, 793-WKTV. I'm going to start off with the question, and I think this is probably on the minds of many of our viewers. It's in regards to dental anxiety. There is probably a lot of urban myth out there that it's a bad place. I don't want to go to the dentist. Oh, right. It's going to hurt. Right. Well, you know what? There are some myths to it, but there are some truth to it. So let's kind of iron those out now.
Yes. I wanted to bring up especially, Jason, last time we had a caller that had a daughter that was 14 years old and had high anxiety. And we talked a little bit about what she could do at home as far as helping her daughter to get over that anxiety and create good home care herself. But the even goes beyond that is that what the mom could really do to take advantage of trying to help her daughter is to establish a good relationship with a local dentist, or maybe she has a current one, to go into that dentist and really tell the dentist, look, I've got a daughter that has high anxiety. What can I do about it? So he'll understand, try to talk to her about what he can do for that daughter. If he can get her in and have the conversation with her about her anxiety and what's available today to really handle that, the reason that's so important is because if a patient has high anxiety and they have this avoidance issue with going to the dentist and they stay away and away and away, there's small problems become large problems.
Bigger, yes.
And if she can get in and be a routine patient, then those problems can be identified sooner than later. And normally when they're small problems, they're very easy to deal with, and the patient doesn't have to have this high anxiety. And the more frequently they come in, that really helps handle the anxiety in itself also.
Outstanding. We do have a call, so let's go right to it. 793-WKTV. Go ahead. What is your question this noon? Hello?
My question has to do with implants.
Okay.
I've had implants upper and lower. Now, my upper has been giving me a lot of problems. When I bite, the back end will drop. And on my bottoms, they just pop out. As far as the uppers, that's the one that gets me the most. Would there be a plan for that?
Absolutely, because you know, dentures, especially dentures, if they're worn for a number of years, what ends up happening is they become ill-fitting. Like the gentleman's describing, when he bites down, maybe he's just hitting in the front, so now the back drops down. What he really needs to do is come in, have some impressions taken, make a whole new set of dentures first, something that he can become comfortable with. What that does is that establishes for us where the bite should be initially, and then get comfortable with those first. Then we can utilize those to make what we call scanning prostheses that can be worn at a CT scan and then develop a complete plan for implants. And if that gentleman would come in and see the possibilities for that, it's huge as far as implants today. It's like night and day between dentures. So I would highly encourage him to pursue that because he would see a big benefit.
All right, thanks for that call. Thanks for coming in, Doc. Always good to see you, my friend.
Okay, Jason.
All right, we'll see you again soon.
Okay, very good.
We'll wrap up the newscast after the break.